Hello, welcome to my channel. Today we'll be doing questions and answers in psychiatric nursing. This will be part 1. Please hit the thumbs up, please subscribe, and please share this video. My first question is, client diagnosed with schizoid personality disorder, which signs would client exhibit during social situation? The correct answer is paranoid thoughts. Client experience excessive social anxiety, which leads to paranoid thoughts. Please note, these questions and answers are taken directly from nclex-rn examinations. My next question is, when planning care for client using ritual behavior, nurse should recognize that. The correct answer is helps controls clients' anxiety, used for clients with OCD, obsessive compulsive disorder. My next question. What would you teach family in group therapy? The correct answer is personal characteristics of abuser. This client was admitted for history of violence. Personal characteristics of abuser includes low self-esteem, immaturity, dependence, insecurity, jealousy. I'll repeat this question. What would you teach about violence to family in family group therapy? The correct answer is personal characteristics of abuser includes low self-esteem, immaturity, dependence, insecurity, and jealousy. My next question, what is the late signs of heroin withdrawal? The correct answer for late sign of heroin withdrawal is vomiting, diarrhea, abdominal pains and cramps, spasms, fevers, and backaches are late signs of withdrawal symptoms. My next question, client experienced disordered thinking about food. Being poisoned is admitted. The nurse uses which communication technique to encourage the client to eat? The correct answer for client admitted with distorted thinking about food being poisoned is nurse should use open-ended question, nurse should use silence, nurse should encourage clients to discuss their problem in a descriptive manner. What is AlAnon? What is AlAnon? AlAnon. This patient is an alcohol abuse patient, and the correct answer is AlAnon is a family group program of recovery. It's for family and friends of alcoholics, whether or not the alcoholic recognizes the existence of drinking problem, seeks help. The next question is, to establish an open, trusting relationship with client diagnosed with severe anxiety, what should the nurse do to develop an open, trusting relationship for client with severe anxiety? The correct answer is respect the client's personal space. Moving in client's personal space increases feelings of threat, which increases anxiety. Our next question is, clients say, I do not need anyone to talk to. I'm in my room and I have my television, and my television is my best friend. Client is using which defense mechanism? The correct answer is denial. Denial is a defense mechanism that blocks problems from unconscious, refusing to admit they exist. My next question, client admitted with delusions of grandeur. This diagnosis reflects which belief? The correct answer, the belief of being highly famous and important. This looks experiencing false sensory perceptions with no basis of reality. This perception is correct answer for false sensory perception with no basis of reality. The correct answer is visual, auditory, tactile, olfactory perceptions that have no basis of reality, and the correct answer is hallucinations. The next question, client is suffering from phobia about black dog. Nurse anticipates that problem for client would be related to what? The correct answer is anxiety when discussing phobia. Feared object triggers an emotional response to objects. Long-term goal for clients with paranoia, unjustified, accusing wife of having an affair. What would be helpful for this client? Why is this client having paranoia of wife having an extramarital affair? The correct answer is client is accusing wife of having extramarital affair. Client needs to develop from nurse feelings of self-worth. This would reduce client's need to use defenses. I repeat this question. Long-term goal for clients with paranoia. Unjustifiably accusing his wife of having extramarital affairs would be to help the client to develop what? What would the nurse help the client to develop? And the correct answer, the nurse will help the client to develop a feeling of self-worth. This would reduce the client's need to use defenses. The next question is, the focus of environmental melotherapy is, the focus of environmental melotherapy is, the correct answer, manipulate the environment to bring about positive changes in behavior. This will be the focus of your environmental melotherapy. The next question, client diagnosed of dependent personality disorder. Which behavior is most likely to be evidence of ineffective coping? Correct answer, behavior that is most Likely evidence of ineffective coping is inability to make choices and decisions without advice. My next question: to further assess clients with suicidal potential, the nurse should especially alert client expression of. The correct answer is helplessness, hopelessness, unable to continue. I'll repeat this question. To further assess client's suicidal potential, the nurse should especially alert client expression of hopelessness, helplessness, hopelessness, unable to continue. Helplessness, hopelessness, unable to continue. What is the complication associated with intractable anorexia nervosa? What is the complication? And the correct answer is cardiac dysrhythmias resulting in cardiac arrest is the correct answer, is the complication associated with intractable anorexia nervosa. Please note, clients have depleted sodium and potassium levels because of starvation diet. Electrolytes are necessary for cardiac functioning is the correct answer. My next question: what is the appropriate goal for bulimia? The correct answer, the correct goal for bulimia is identify anxiety-causing situations that stimulates the behavior and then learning new ways of coping. The goal is to identify the anxiety causing the situation to stimulate the behavior and learning new ways of coping. My next question is: client with borderline personality to be discharged, threatened to do something to herself. The correct answer is, the correct answer for clients threatening to do something to herself is discuss meaning of client statement. Any suicidal statement must be assessed by nurse to determine its meaning. In terms of suicide, this patient was borderline. She's threatening to do something to herself. So the nurse has to determine the meaning in the terms of suicide is the correct answer. My next question: client is pacing the floor, appears extremely anxious. Most therapeutic question in attempt to alleviate your patient's anxiety is correct answer. Would you like me to talk with you? The nurse's presence may provide client with support and feeling of control. And this is for a client who is extremely anxious. To alleviate the anxiety, you ask the client's permission. Open-ended question: would you like me to talk with you? The nurse's presence may provide clients with support and feeling of control. The next question: nurse aware of language development in autistic child resembles what? And the correct answer is echolia. Echolia. ECHOLALIA. Child repeats word or sounds spoken by others is the correct answer for the language of an autistic child. The next question is, clients with extreme depression seem to do best in settings where they have what? Clients with extreme depression seems to do best in settings where they have what? The correct answer is simple routine activities are best, least stressful, and least anxiety provoking. The next question is, client with withdrawal due to alcoholism has tremors, diaphoresis, hyperactivity, blood pressure elevated. Nurse should expect to administer which medication? And the correct answer is Ativan. Ativan is administered for clients diagnosed with alcoholism with experiencing withdrawal symptoms. The next question, client diagnosed with suicidal ideation. When client goes to the bathroom, what should the nurse do when client goes to the bathroom with a suicidal patient? The correct answer, observe the patient. You should go with the patient. A suicidal patient should not go to the bathroom with the door closed. Patient is hoarding medication. Please note this patient is suicidal. This patient is talking about death. Watch for all clues of patient. This patient is suicidal. Observe the patient. The patient could be hoarding medications. And we will thumbs up on this video. We'll subscribe and we share the video. Please stay tuned to part 2 of questions and answers for psychiatric nursing. Thank you. Have a good day.